This is Jerry Hesch, physical therapist at Hesch Institute in Aurora, Colorado. And my client is a young 53-year-old. And she gets episodic low back pain, episodic headache. One thing that stood out in my evaluation, I was very surprised to find that when I test internal rotation of her hips, she goes just slightly past neutral. About 10 degrees, and there's a firm end feel. If I push harder, it feels very resistant. And that's a symmetrical pattern. And on the basis of this tightness, I predict that she's going to be tight in her upper cervical spine, and we found that to be true. The first vertebrae, called the atlas, compensates for movement dysfunction in the lower body. And when I come underneath the mastoid, then I can touch the outside, the transverse process of T1. And there's a shallow sulcus. So that's an indication that she might be hyperextended in the upper cervical spine. And now what I'm going to do is push my left index finger to the right. And then I'll push, on the right side, I'll push her spinous process, transverse process rather. I will push it to the left. And I'm attempting to do that now. And there's no movement with a reasonable amount of force. There's no movement on either side. If I come down to C2, you can see her whole neck moves. With a reasonable amount of force through my finger, there is side glide movement of her neck. And when I do that on the right side, there's side glide movement. The occiput has good mobility and rotation on either side, pushing it downward with my thumb. And when I come beneath the mastoid and I lift up, there's a little bit of side bending motion on either side. So I don't blame the head and neck joint, which is called occipito-atlantal joint. I implicate the atlas, the first vertebrae, as being restricted in hyperextension. So here's the question. If we increase her hip rotation, will this pattern release? And I'm going to suggest that in fact it will. And the technique that I like for releasing the hip rotators addresses all of the hip rotators. And I use a 2-inch by 4-inch by 8-inch foam. And I like this foam because it indents slightly, so it has a little bit of give, and it conforms to the shape of the body and is therefore comfortable. So we find the trochanter, this bump on the outside of her hip, and it's right outside the pocket, just slightly below. You can roll the leg in and out and you'll feel that bump exaggerate. And so the middle of this foam is under that bump. So I put this under the pelvis on the outside, and I'm going to put one on each side. And again, it's 2-inch by 4-inch by 8-inch foam. And you can substitute with a firmly rolled towel. You could roll it up tightly and tape it, or you can buy these off of our website. I have not seen them on Amazon. So I'm going to stop filming now because she's going to stretch for 5 minutes, and then we'll come back and check the response to that, okay?